Do you want to know the best ways to communicate with healthcare professionals to ensure that you receive the important information you need and answers to your questions? I am Tara, creator of Aging Your Way, and in this video, I will give you 7 little known strategies that I use when I'm a patient or when I'm advocating for a loved one receiving healthcare. I will also share a few insider tips from my 25 years of working in healthcare related to why asking questions of your healthcare provider is important. I'll even include a few tips that only someone who has worked in healthcare for several years would probably know. Like many of you, I have encountered unfriendly and unhelpful healthcare professionals that only made me question why they chose a career based on helping people. I have worked with them and I have come across them as a patient myself. I will never make excuses for rude or dismissive healthcare professionals. If you encounter one, I encourage you to go to their boss and share your concerns. And if it feels right to you, exercise your right to choose a different healthcare professional and move on. In recent years, there has been a push for healthcare providers to focus more on customer satisfaction, and it is long overdue, in my opinion. In fact, Medicare and other payers are starting to connect reimbursement to patient satisfaction, which I think is a very good thing. I want to emphasize that the large majority of healthcare professionals I know are dedicated to helping you. They want you to have accurate information to manage your health, and they want to answer your questions. Now, on to the 7 strategies for communicating with healthcare professionals. I want to note that these strategies apply to communicating with physicians, physician assistants, nurses, nurse practitioners, physical and occupational therapists, etc. And they apply both in the hospital setting and in the clinic or doctor office setting. Number 1, let the healthcare professional know that you have questions at the start of your interaction with them. This can be as simple as saying, when you finish blank, such as performing an exam or giving medication, I have a few questions. A bonus tip related to this is if the healthcare professional tries to leave the room or the area without answering your questions, be assertive and speak up. When this happened to me once, I said something to the doctor like, "Please wait, I still have 2 questions for you." And then I launched right into my first question. It's possible that a healthcare professional could forget that you said you had questions, but either way, speaking up sends the message that you are going to hold them accountable for answering your questions. After all, this is your health that we're talking about. Number 2, keep a list of your questions and have it in hand when you talk to the healthcare professional, whether that's the doctor, physician assistant, etc. That can be a paper list or an electronic list on your phone or tablet. Either way, ensure that it's easily accessible so you have it ready when you ask your questions. I have shadowed physicians in their offices and in the operating room throughout my career. I can assure you that one thing the medical TV shows get right is that doctors are almost always racing against the clock to do more things than they have time for. So, to get the most out of your time with the doctor, have your questions ready. And a related bonus tip is prioritize your questions and ask the most important ones first. As a patient or the loved one of a patient, you are absolutely entitled to the doctor's time. Just remember to use it wisely so that you maximize your time with them. The third strategy is to have medical information, including a list of current medications, organized and ready to share or reference when you're talking to a healthcare professional. I promise you, the time it takes you to put all your or your loved one's medical information in one place will save you many hours of time and potential confusion down the road. It will also help decrease the chances that a healthcare professional will overlook something important about your health because they didn't have that important piece of information. I have worked with many clients who keep all of their medical information on paper in an organized binder. There are also many options available to store this information electronically, and I believe there are even a few apps available. Choose a method that works best for you and ensures that you can quickly access the information when you need to, whether it's in a doctor's office or in the emergency room. And a bonus tip is never assume that the healthcare professional in front of you has access to your entire electronic medical record. I can guarantee you that they often do not. Next, I recommend you communicate in a clear and firm manner. The way in which you communicate with a healthcare professional will impact how much they can help you. They need accurate and pertinent information about your health to best serve you. Now, I love a good storyteller, but I promise you that you will get a lot more out of your interaction with a healthcare professional if you communicate in a clear, straightforward manner. You will want to get to the point fairly quickly. So, when you are communicating with a healthcare professional, please try to avoid telling a long story with lots of details that are not pertinent to the reason you are there. It will hinder you from receiving the maximum benefit of that professional's expertise in the limited time you have with them. Also, for the more timid, passive people, feel free to tell the healthcare professional exactly what you are expecting of them. Here's an example of what you might say if a healthcare professional tells you that recent tests show you have congestive heart failure. You might say, "Well, that concerns me, and I want to know exactly what I need to do to manage this." Please don't accept being told, "Fill out the prescription, someone will call you with more information," and then be sent on your way. You are entitled to more information about your health. The next strategy is to communicate in a kind and respectful manner. It is very tempting to yell or be rude to a healthcare professional when it feels like they are not listening to you or not answering your questions. I believe it is completely understandable to be upset in those situations and share your frustration with the healthcare professional and their manager if that feels right to you. But I recommend you do your best to communicate in a calm and clear manner. The healthcare professionals are going to struggle to understand your concern if you are yelling or threatening them. If they don't understand your concern, they will not be able to help address it. Should healthcare professionals always give you and your loved one good care no matter how you treat them? Of course, and many do. But from what I've observed, a person yelling at healthcare professionals does not result in better care or worse care for you or your loved one. It only results in healthcare professionals disliking their jobs. The next strategy is to take notes on the conversation you have with your professional. I don't recommend making the healthcare professional wait while you take detailed notes when they're talking, but do write down keywords or medications that they mention. And definitely write down next steps and recommendations the healthcare professional gives you. I also recommend reviewing the notes and adding more details as soon as possible after the conversation while it's still fresh in your mind. And don't forget to keep these notes with all the other medical information you have. A bonus tip related to this is if you realize later that you don't understand something that you were told or have additional questions, please call the healthcare professional or their office and ask for clarification. The last strategy I recommend before I share my insider tips is this. If you can, try to give positive feedback to healthcare professionals who are doing the job well. Many healthcare professionals will tell you that they don't do their jobs expecting gratitude or praise from their patients. But I think it's always nice for anyone to hear that they are doing something well. When a person receives positive feedback for doing certain things, they're more likely to continue doing those things. Now, on to those insider tips. For those of you who feel like you don't have the right to be assertive and ask questions of healthcare professionals, especially doctors, here are 3 reasons to be assertive about your healthcare and ask questions. Number 1, nothing is more important than your health or your loved one's health. This is your body and you only get one of them. You can and should obtain as much information as you can about how to take care of that body. While you do have to trust the healthcare experts to a certain degree, you can and should advocate for your or your loved one's health and ask questions. Side note, while working as a physical therapist, I once treated an auto mechanic who told me that he could not believe that people drive their cars all over the place every day and have no idea what is happening under the hood. Without much thought, I replied, "Well, I cannot believe that people walk around every day and have no idea what is happening inside their own bodies." The second tip is communicating effectively and asking questions signals the healthcare professionals that you are engaged and that you take ownership of your healthcare. So don't hesitate to ask those questions or request clarification. A good healthcare professional will not be offended by your questions, I promise. Many of us love to answer questions and educate our patients and their loved ones. However, if your healthcare professional is dismissive of your questions or rude to you, I would find a replacement for that healthcare professional ASAP. The third tip is asking questions, being engaged shows your healthcare provider that they need to stay on their toes, and it may give them another reason to give you excellent care. There are some healthcare professionals who would not appreciate me saying this, but I've seen the following type of scenario play out dozens of times in my career. The example is this: a healthcare professional who usually provides adequate care to their patients but doesn't go above and beyond sees a patient who asks a lot of questions. After seeing this patient, the healthcare professional goes into the office or break room and says to their colleagues, "Wow, my last patient just asked me like 10 questions. I had to double check and verify I was giving them the exact information they wanted." The best healthcare professionals do double check their work and ask their colleagues to double check and verify their work as well. Some healthcare professionals just need a little extra motivation to do this, so ask those questions. In closing, there is a lot of room for improvement in the healthcare system, both with healthcare professionals and with the system as a whole. But we all need healthcare, so I hope you will use some of these strategies for communicating with healthcare professionals to ensure that you and your loved ones get the best possible healthcare you can. One last tip: if you don't understand what a healthcare professional is saying to you, please say something like, "I'm not sure I understand. Can you explain that in layman's terms?" And then repeat that as often as necessary until you do understand. For more valuable information on this topic, go to agingyourway.net and read the blog post titled 7 Strategies for Communicating with Healthcare Professionals. And if you would like help with navigating any aspect of the complex healthcare system, please go to agingyourway.net to learn more about our Aging Advisor services under the Services tab. The initial 30-minute consultation is always free. Thank you so much for your time. Please don't forget to like and subscribe below as well.